Having a medical problem, where do you go? The hospital or a medical clinic, right? Well, when someone's having a mental health crisis, where do they go? Right now, they also go to the hospital. KTIV's Taylor Deckert continues our conversations on mental health crisis with a closer look at how area hospitals are taking matters into their own hands to address a lack of services in the area.
When people experience a mental health crisis, you take them to the nearest emergency room.
Every day in the emergency room, we see many patients, up to 120 patients a day, and many of those patients come with different issues and concerns. On an average, we can have up to 4 to 5 patients in our ER boarding, waiting for the right mental health bed to open.
In Siouxland, a large portion of those patients come to Unity Point Health St. Luke's. But often there are not enough beds due to the increase in people facing this problem.
We have children as young as 6 years of age all the way up to geriatric patients, so finding the right placement for those patients is really challenging, as there are limited beds in the state of Iowa.
People who experience a mental health crisis are often brought here, the emergency department. On any given day, there can be 3 to 10 people in the ER who are in need of care, but are stuck in the emergency rooms because there's nowhere else to send them for treatment. According to Health and Human Services of Iowa, there are 901 licensed beds for inpatient psychiatric programs as of January 2024. Only 4 of those facilities are in the Siouxland area, with 78 beds total.
Sometimes we do have to cross state lines in South Dakota and Omaha, Nebraska, to get those patients placed in a place where it's safest for them.
St. Luke's has a new behavioral health coordinator making the rounds on the patients dealing with a mental health issue.
When they're in a psychiatric unit, they get therapy, they get certain medication, and so she rounds on those patients to ensure that they're getting the right care, they're getting the therapies that they need, the recommendations for inpatient or outpatient mental health treatment. And so she's really played a key role.
They currently have 1 ligature-free behavior safe room, meaning that there are no cords or anything to harm themselves with more rooms on the way.
We have outgrown the number of rooms that we need here in our hospital. The end of May, beginning of June, we should be starting construction on 5 more behavioral health safe rooms to help ensure that we have safe rooms for our patients who are in a mental health crisis.
In Sioux City, Taylor Deckert, KTIV News 4.
The main problem is a lack of psychiatric beds, but that also means there's a lack of providers. State Representative J.D. Scholten of Sioux City is part of a bipartisan group that's pushing for more funding to help address those issues.
Funding is the most obvious answer that we need to be doing more of. You see that in the state of Iowa, we are 51st in the nation in mental health beds per capita, and we shouldn't be last at anything. We're too good of a state where we have too much pride to be last at this. And so this is not just a urban or rural issue. This is the entire Iowa.
At the end of this year's legislative session, lawmakers sent several bills related to behavioral health to Governor Kim Reynolds. One covers behavioral health services for children, including psychiatric medical institutions for children. Another aligns Iowa's 13 mental health regions and 19 substance use regions into 7 unified behavioral health districts. In a statement on the change, Governor Reynolds said, in part, "We align the state's behavioral health system to support consistent, coordinated care and to improve outcomes and establish Thrive Iowa to help at-risk individuals find local support and create a plan for self-sufficiency and long-term independence."